Is psychiatry too focused on medication? It's a question many people are asking, quietly or out loud, because for some, psychiatric medication is life-changing, and for others, it feels like a first and only solution to deep emotional pain. So let's pause, let's take a breath, and have an honest conversation. The purpose of psychiatry. Psychiatry is the medical specialty that deals with mental illness. Psychiatrists are trained medical doctors. They can prescribe medications, diagnose mental health conditions, and sometimes provide psychotherapy. But let's be real, in today's world, when most people see a psychiatrist, it's not for talk therapy, it's for medication. Appointments are often 15 minutes long, a few questions, a quick summary, a prescription. So naturally people start to wonder, is this all there is? Why medication became central? Let's rewind a little. In the mid-20th century, the field of psychiatry went through a major shift. Antidepressants, antipsychotics, and mood stabilizers began to change the way mental illness was treated. People who once would have spent years in psychiatric hospitals could now function in society. Medication made it possible. And let's be honest, medication can save lives. It can pull someone out of suicidal depression. It can calm a racing manic mind. It can help someone with schizophrenia distinguish reality from delusion. So no, medication isn't the villain. It's a tool, a powerful one. But the problem begins when it becomes the only tool. The medical model of psychiatry often works under what's called the medical model. This model sees mental illness as a chemical imbalance or brain disorder, something that can be fixed with medication, like diabetes with insulin. There's some truth to this. Brain chemistry does play a role in mood, behavior, and thought, but it's not the whole story. You can't scan someone's brain and see depression. There's no blood test for PTSD. You can't measure anxiety like blood pressure. Mental health is influenced by trauma, relationships, childhood experiences, lifestyle, sleep, nutrition, community, purpose. In other words, we're not just brains, we're whole people. And when psychiatry focuses too narrowly on chemicals, it can overlook the human context, the 15-minute med check. Let's talk about what happens in most psychiatric visits. You fill out a symptom checklist. The psychiatrist asks how you're sleeping, how your appetite is, how your mood has been. Then they adjust your medication or prescribe a new one. The entire session may last 10 to 20 minutes. That's it. There's no time to talk about your childhood, no space to explore your trauma, no deep dive into your relationships, your fears, your dreams. It's not that psychiatrists don't care, many do, but the system is built for efficiency, not depth. Insurance companies reimburse for prescriptions, not for hour-long conversations. So the path of least resistance becomes the path of pills, the risk of over-medication. Here's what can happen when psychiatry leans too heavily on medication. Quick fix mentality. People expect a pill to solve deeply rooted emotional issues. Misdiagnosis. Without enough time, complex emotions can get labeled as disorders too quickly. Side effects. Psychiatric medications can cause weight gain, sexual dysfunction, emotional blunting, and more, which sometimes go unaddressed. Polypharmacy. Some patients end up on multiple meds at once, creating confusion and risks. Loss of personal agency. People start to believe that healing only comes from a pill, not from within themselves. Again, medication can be helpful. Sometimes it's essential. But when it's overused, it can become a barrier to deeper healing. The missing pieces. Therapy, lifestyle, and connection research shows that therapy works, especially when combined with medication for certain conditions. Cognitive behavioral therapy, trauma-informed therapy, mindfulness, somatic work, these approaches can help people heal in ways that medication can't reach. Lifestyle changes matter too. Exercise boosts mood and focus. Nutrition affects brain chemistry. Sleep stabilizes emotions. Purpose, routine, social support. They're all part of mental wellness. But these are rarely addressed in a 15-minute visit. That's not psychiatry's fault alone. It's how the entire healthcare system is structured, reactive, time-limited, and centered on diagnosis and prescription. What patients deserve. What if psychiatry wasn't about what's wrong with you, but instead, what happened to you? How are you really doing? What's your story? Mental illness is rarely just a chemical glitch. It's often a response to pain, past or present, and medication may soothe the symptoms, but healing comes from being heard, seen, and supported. What patients deserve is not either or, not medication or therapy, but a balanced, integrated approach. When medication is truly needed, let's also be clear, some mental illnesses are severe, chronic, and truly biological. Schizophrenia, bipolar I disorder, severe recurrent major depression. In these cases, not using medication can be dangerous. It's not a weakness to take meds, it's wisdom. But even then, medication is most effective when it's part of a larger treatment plan, including therapy, support systems, and personal growth. A new model of mental health. Imagine a model of psychiatry that worked like this. You meet with a provider who spends time getting to know your story. You discuss treatment options, not just medications, but also therapy, lifestyle, and community resources. You're part of the decision-making process, not just a passive patient. You're seen as a human being, not a diagnosis. That's not a fantasy. That's what mental health care should be. And many providers are moving in that direction, integrating psychiatry with holistic care, functional medicine, and trauma-informed practice. It's happening, just not fast enough. So, is psychiatry too focused on medication? The honest answer? In many cases, yes. Not because psychiatrists don't care, not because medication is bad, but because the system is unbalanced. We've made pills the centerpiece and left out the parts of healing that take time, effort, and conversation. The solution isn't to throw away medication. It's to restore balance. Because mental health is complex. Because people deserve more than a prescription pad. And because healing is possible, not just with a pill, but with presence, partnership, and purpose. Final thoughts. So if you're on medication, there's no shame in that. If it's helping you, that's a beautiful thing. But also ask, am I getting therapy too? Am I addressing my environment, habits, and relationships? Am I being seen as a whole person? If not, it's okay to ask for more, to advocate for yourself, to explore other tools, not just one. Because true psychiatry isn't about just silencing symptoms, it's about supporting your wholeness. And that's something no pill by itself can ever do.